A very good morning, everyone, respected panelists. And today I'm going to present about the Myopic sleep due to the increased screen time during this lockdown due to the COVID pandemic in the 2020. And I have no financial interest. So in December 2019, a novel coronavirus rapidly spread in China and all over the world. In response to the COVID, the government of different countries, including India, started nationwide lockdown to prevent spreading of the infection. So now there is increased use of digital platform for education, to job and to recreation amongst all the age group of the people. And myopia is a major visual defect issue around the world. The WHO estimates that half of the population of the world may be myopic by 2050. And in recent years, less time spent in the outdoor activities and increased duration and intensity of the near work have been recognized to be associated with myopia. So in this study, our aim was to investigate the increased screen time during the lockdown 2020 is associated with some myopic shift. So my materials and methods, it is a prospective observational type of study. So the number of patients included was 189 and the study period was 3 months only, May, June and July of the year 2020, and the place was Rio SCVMCH, and the age group of the patient included in the study was 12 to 35 years. So the patient who presented with the chief complaints of like defective vision or the decreased vision with the current glasses using asthenopia, headache and lacrimation are included in the study. So these patients were then subjected to visual acuity test, then slit lamp examination, autorefractometry, and then trial of the glasses. So visual acuity was tested using Snell's chart, both without the glasses and with glasses who were previously using it. And the slit lamp examination was performed on all patients to rule out the other causes of diminution of vision, like any corneal diseases like dystrophy or any causes of lacrimation like dry eye diseases or anything. And autorefractometry was then done, and after that trial of glasses was done for all the patients. The astigmatic patients were excluded from the study, and the BCB of every patient was recorded. So this is the male is to female ratio. Male was 57% and 43% were female. And this table of showing the age distribution of patient, mostly we are the most number of patients we can see it is the age group of 20 to 23 age group, and up to school, and after that the school children like 12 to 15 years of age. So and previously myopic were there are 45 patients were previously myopic, and previously non-myopic were 144 patients. And this table was showing the increase in the diopteric power in non-myopes and in the myopes. There is, we have taken up to -1 diopter, so up to -0.25 diopter in non-myopes, the number of patients are 48, up to -0.50, that is 32, up to -0.75, that is 37, and -1 is 27 patients. And in previously myopic patients, similarly, increase in -0.25 diopter was seen in 17 patients, and -0.50 diopter was seen in 21, and -0.7 in 7 patients. So the average increase in the screen time was 3.16 to plus or minus 1.44 hours per day, and the increase in screen time was for purpose of online classes amongst the school and college people, for work from home amongst the job holders, and for entertainment purposes, and other for all of the cases. So the 144 patients, like 76.2% who were previously e-metropic, showed myopia of range -0.5 to -1 diopter, and 45 patients who were previously myopic showed increase in myopia by -0.25 to -0.75 diopter. So coming to discussion, so the result of the AIOC study demonstrated a positive correlation between the increased screen time and myopic shift, but the combined effect of near work, including computer use, reading time, and reading distance, increases the odds of myopia. So the symptoms patients presented with were mostly eye strain, lacrimation, and blurring vision. So issues with accommodation had also emerged with increased visual strain despite terminal uses due to the slowing of the focus change in computer or any digital display screen uses. So the myopic shift was found to be minus 0.25 to minus 0.75 diopter among the previously myopic patients, and minus 0.25 to minus 1 diopter amongst the non-myopic patients. While the direct links between screen time and prolonged permanent myopia have not been found, but the possibility that it exists is still prevalent. A meta-analysis spanning 12 cohort studies and 15 cross-sectional studies have and including 25,025 children among 6 to 18 years of age concluded that there was an evidence rating of only recommending a reduction in time speed with the reading to reduce the risk of myopia. And our studies has its flaws, like less number of subjects we have taken, and also these patients were not followed up later. So conclusion being, while the literature is largely inconclusive when it comes to determining whether or not increased screen time has a causative link to myopia progression over time, but there have been studies that suggest a possible link between these two. The involvement of near work activity and the decreased time spent outside seem to have a possible correlations with increased amount of refractive error. And all the government should implement guidelines for the online platform users for schools and colleges to prevent further myopia. And these are my references. Thank you.
Thank you, doctor. Any questions for her, please?
Yes, very nice study and very much needed at the present time, because we are still going through the pandemic. And I think this is very important because all of us saw a lot of myopic increase in our patients. So I like the idea. Good job.
Only thing problem is we do not know whether the subjects were included in this. Even without this, whether they would be having an increase in myopia for the previous myopes, or even otherwise those who are prone for myopia, would they have gone in? So that needs something, because this naturally COVID days and screen time, we know that increased screen time, increased near vision increases chance of myopia. So that's all well in literature. But here in this context, it is good that studies are being done, but we need a very long follow-up, and the other ancillary factors also which we taken in to say that this is this. That's all. Okay. Thank you.
Also, whether we deprive the person of screen time, whether the myopia will reverse. That was what I was thinking.
Long follow-up is required.
1 or 2 months of deprival should also be studied from screen time and what happens.
Deprival would be most difficult to achieve.
Absolutely. About to say that. How will you deprive them?